We are very privileged to have Ms Anuradha Gupta with us today, who's a global health leader and is currently President of Global Immunization at the Sabine Vaccine Institute, Washington, D.C. Before that, Anuradha was at Gavi, the Vaccine Alliance. And with Anuradha's help, today we want to spread awareness about the cervical cancer. Welcome, Anuradha.
Thank you, Manju.
Yeah, today, if I could pose the first question to you, Anuradha, what is the global incidence of cervical cancer? And also, if you could specifically mention about India, because there's very little awareness about this cancer. There are a lot of other cancers which we know of, but cervical cancer is something that we are not aware of. People don't talk about it.
Yeah, so that's a very good question. Cervical cancer, absolutely awareness is low at this point, but this is becoming a very huge public health challenge. The number of cervical cancer cases is going up every year. Now we have more than 660,000 new cases. That means, more than 6.5 lakh cases every year globally. And deaths actually are more than 350,000 every year. So really 3.5 lakhs of women dying, and most of them in the prime of their youth. And what is very worrying is this trend of an increase in younger women aged 15 to 49 years. That's where we are seeing cervical cancer rising. And that's really a very big reason to worry about.
Right. But is cervical cancer preventable? And how can we prevent it?
Yeah, so I omitted to mention that India actually accounts for 20% of the global cases of cervical cancer and also deaths. And we typically say that every 8 minutes, a woman dies of cervical cancer in India. So even in India, not just the world as a whole, but in India, cervical cancer indeed is an emerging challenge. Now, yes, the good news is it is absolutely preventable, unlike many other cancers where we don't understand the causes very well and prevention is not possible. Here, in case of cervical cancer, we have a full understanding of what is the virus that causes it. So it's a human papilloma virus called HPV. That actually accounts for majority of cervical cancer cases. And we have the tools now, fortunately, to prevent HPV converting into such a serious infection that leads to cervical cancer. So the prevention has two aspects. One is vaccination, which we call primary prevention. And we have very safe and effective vaccines against HPV, and cervical cancer-inducing strains of HPV. And these were developed more than 15 years ago. And a lot of rich countries have introduced this vaccine for young girls. And with amazing results, we have a lot of data coming out of Europe and the US, which shows that girls who were vaccinated, during their adolescence, before they became sexually active, actually are showing no incidence of cervical cancer. So vaccines are the first and the foremost primary prevention against cervical cancer. But also we have many younger women, not younger, we have many older women, more than 15 years of age, who would not have received this vaccine or would probably never receive this vaccine and are already sexually active. So in their case, screening is a very important tool that is now available. And we have very advanced screening tests for HPV, which also include self-sampling. And it is very easy now to find out whether there is a lesion, a pre-cancer lesion that can progress into full-blown cervical cancer. And I think the good aspect with this disease is that cervical cancer progresses very slowly. So it takes between 10 to 15 years to actually become full-blown cervical cancer. So we have a window of opportunity that when women are showing a pre-cancer stage, screening tests have the ability to pick up the disease at that stage, and then there are very simple ways to actually get rid of pre-cancer lesion. So, and we call that secondary prevention. So screening and cancer treatment is secondary. So primary and secondary prevention combination can absolutely prevent cervical cancer.
This certainly, it sounds like a very good news, but two questions for our viewers. One, I picked up you're saying before the girls become sexually active, and therefore it's difficult to say at what age it should be given. It should be, it may be country specific. And the second question I wanted to ask is, you mentioned the developed countries. What about countries like India? Is there acceptance of this vaccine? Are these vaccines available at a low cost so that parents could actually access health centers to get this vaccine? If you could just let us know a little about that.
Yeah, so the first part of your question about girls and becoming sexual active, and that the age will vary, from society to society, because it's also cultural, right?
Yes.
In most cases. So the recommendation by WHO is to actually vaccinate girls anytime between 9 to 15 years of age.
Oh.
And because that is the time when they attain puberty. And, depending on which country they are living in and which society and the cultural norms, the age of their sexual debut would vary. So therefore, the countries have to decide, what is the appropriate age at which they would start to vaccinate girls.
Right.
As regards the introduction of this vaccine, as I said, more than 100 countries introduced this, mostly rich countries in the beginning, because first, supply has been limited of this vaccine, but also because of costs. The cost typically of new vaccines tend to be quite high, in the beginning, till such time as the vaccine markets become more diversified and more healthy. And typically a HPV vaccine dose would cost more than $100. In the beginning, there were 3 doses that were recommended. So it is quite expensive. So those countries that had the financial resources to introduce this vaccine did that, right, with remarkable results. As I said, they also introduced screening services. But then later, WHO's recommendation was to about 2 doses. So, 2 doses are sufficient. And a very big breakthrough came recently, where the studies demonstrated that even a single dose of HPV vaccine gives equal and very solid protection. So 1 dose really means that countries can now save on costs. It is also easier to administer because you don't have to follow up girls. But another very exciting development is that HPV vaccine market has become healthier, more diversified, and we have now new manufacturers from emerging economies jumping into the fray, and that has driven down the cost. So one, Gavi, the Vaccine Alliance, where I was working previously, actually introduced or incorporated HPV vaccine as a part of its portfolio. That means it is supporting countries, low and middle income countries, to introduce this vaccine and scale it up. And then the costs are largely borne by so it has become possible for low and middle income countries to introduce this vaccine and roll it out. But then also for countries like India, right, it is now very possible to procure this vaccine at a very affordable cost and roll it out and make sure that all eligible girls are receiving it.
So any thing that you want to add in terms of either Sabine Vaccine Institute's efforts in talking to the governments, or because I think here a bit of convincing may be required in low and middle income countries to take up this as a women's issue. The women's issue, they are coming into prominence now, but we've seen that women's health have been a neglected issue. So any efforts that are being made with the governments, and especially Government of India, if there are?
Yeah, so first of all, I did not mention this, but it's an important thing to keep in mind that 95% of cervical cancer does happen in low and middle income countries. So
Right.
I always like to say that cervical cancer is first and foremost a disease of inequity. And it is those countries which do not have the resources to provide these services to women. But I think, as you rightly said, women health has always been a very neglected area. Women themselves do not pay much attention to their health. They are so busy looking after their family and investing in their children and looking after everybody except themselves.
Right.
So I think women are not strong advocates for their own health. And even when there are services, women sort of just don't find time to go and avail of those services. So,
Right.
so I do think that's a major challenge. But I also feel that awareness about cervical cancer has been very low. So one is general neglect of women health related issues. But like breast cancer, there is much better awareness, right?
That's true.
But cervical cancer, ovarian cancer, these are cancers, where awareness is very low. So I think our work with our partners is constantly underscoring the point that awareness is what is needed. We need to educate not just women and communities and their women's families, but also policymakers, decision makers, even providers. So there
Right.
is some very interesting evidence that came out of Malaysia very recently, which showed that even, doctors and service providers had a lot of myths and misperceptions about the disease itself, why it
Right.
is caused, how it is caused. So I think there is that factor which is very important. As regards India, as I said, India accounts for 20% of cervical cancer cases. It has huge population, and it's important that it rolls out primary and secondary prevention. Now, the good thing in India is that they now have a non-communicable diseases focus program where actually they are recommending that all women should be screened against for cervical cancer, at the primary healthcare level. It is an old method, but the unfortunate thing is that screening rates in India actually are less than 2%. So there
Right.
is data showing that less than 2% women have ever been screened for cervical cancer. So I think there the challenge is going to be to make sure that those factors and barriers are identified, which are holding back coverage of screening methods, and which also includes building skills of frontline health workers, because
Right.
they are the biggest advocates, right? So if they understand what is the disease, how it can be done, how they can screen women, it will go a long way. But I think on vaccination, India is now, as I said, has a large population, and they do not roll out a vaccine unless they're self-sufficient, right,
Right.
in terms of vaccine production. So we have now Serum Institute of India, a very large vaccine manufacturer now on the global map, who have really changed the whole sort of complexion of vaccine markets. And they have started to manufacture and produce HPV vaccine. Of course, the supply, will take
Will take
time to
time.
ramp up. And that is why we were so pleased to see the budget announcement where the finance minister announced that this HPV vaccine to prevent cervical cancer will be rolled out in India very soon.
Thank you so much, Anuradha. I think we should end on this very positive note. And there are a lot of takeaways from your talk. I won't try and repeat, except to say that we need to roll out probably the awareness about the HPV virus and the vaccine itself, uh, like the polio vaccine or like the breast cancer, things which have taken time, but we've seen really good success. And I hope in the coming years, through your efforts and the institutes that you're associated with, we can increase awareness, train the workers, as you said. I think that's really important. And ultimately see improvement in vaccine uptake and obviously improvement in women's health. Thank you so much
Thank
for
you.
talking to us. Yeah.
Thank you, Manju. Thanks a lot. Thank you.